Assalamu alaikum. My name is Dr. Zara Masood. I'm Associate Dental Surgeon at Dental Art and also course organizer at Pakistan Academy of Advanced Dentistry, where we conduct the latest courses on the implant dentistry, orthodontics and restorative dentistry. I'm also a media speaker. I go to various media channels to create awareness about the dental problems and the dental hygiene. World is observing Hepatitis Day on 28th of July. Now, why we need to observe the World Hepatitis Day? Because of the increasing alarming situation of the growing incidence of hepatitis B and C cases in Pakistan. According to the official news published in the nation, out of every 10, one Pakistani is suffering from either hepatitis B and C. And collectively, there are 1.5 crore people affecting from the hepatitis B and C virus in Pakistan. There is a perception in the society that we dental surgeons are a major source of transmitting these viruses from one person to another. So I would like to tell you some of the precautionary measures to all my dental surgeon colleagues on behalf of this World Hepatitis Day to make sure not to transmit these viruses from one person to another. We must take the precautions for every person as same whether the patient is hepatitis B positive, yes or not. But our precautions will be same for every patient. Because most of the time patient himself don't know about this disease as this hepatitis B and C is asymptomatic in the initial stages. And even if you take the complete medical history from the patient regarding the liver such as hepatitis B and C laboratory test, LFTs, any previous hospitalization or injection therapies or history of the jaundice, hepatitis B and C and about the blood transfusion. So whenever you start the treatment, you must wash your hand with the antiseptic hand wash and to dress up as shown in the picture. All the things which are shown in the picture are the disposable items starting from the head cap to the mask with a transparent sheet on it and with the apron with a full sleeve scarves, high quality latex gloves and the footwear. Now I don't recommend the wearing of the protective glasses because it's impossible to disinfect and sterilize these protective goggles. Even if you are wearing the scrubs or the white coat, you must wear the disposable apron on it because obviously it's impossible to sterilize your scrubs again and again for every patient. The cost of using these disposable items from head to toe is not more than 100 rupees. So you can always start this with the patient and to tell the patient that it is for his safety and for your own safety. The next step is the use of disinfection and the protective barriers for your dental chair. For each and every patient, you must disinfect your dental chair and use the protective barrier. Now there is a long list of the disinfectants which you can use for the disinfection of your dental chair, but I will tell you only one, that is rubbing alcohol, 72% of the isopropyl alcohol, which you can disinfect your dental chair, drawer and the door handles and countertops with it. It's easily available in the spray form and it's available in the Pakistan. You can get it from the advanced Western. Now the protective barrier which you would use for your dental chair is the plastic wrap on the assistant control panel, on the dentist control panel, on the light handles, on the switch handle of the light and on the footrest, on patient side of the spittoon bowl and on the pipes of the handpiece, triple syringe and the suction pipes. There are also protective sleeves for the intraoral cameras, for the scaler machines, for the light cure handles, for the endomotors and the hooks for the apex locator as well as for the agent gels. The important part is that you must have the B class autoclave at your clinics for the sterilization of the dental instruments, because it's the only autoclave that is recommendable by the WHO for the sterilization of medical and dental equipment. After you use the instruments on the patient, now it's important to dip them in a saline solution for at least 10 minutes before washing them under the running water.
Okay.
And the assistant must wear the high protective gloves during washing of the instruments. Now all the shafts that you have used on the patient, such as blade, needles, suture needles, cartridges, extractive tools and syringes, must be discarded in a sharp bin which you can get from the Nurani surgicals. And once it is filled, you can call up to the Shalimar Hospital for the collection of your hospital waste. And all the contaminated waste such as sheets, gloves, gauze, cotton, tissue rolls, napkins, plastic sleeves and the plastic wraps would go into the yellow bin. And the instrument pouches, the used instrument pouches would go into the white bin. I recommend the use of the detachable scaler handpiece, because in most of the clinics there are single unit scaler handpiece which is impossible to sterilize. So it's always best to use the detachable scaler handpiece. I recommend the use of the suction machines whose suction waste directly goes into the main drainage line. Because in most of the OTs and the clinics, they are the suction machines who have the jars in them, and it's very difficult to clean and disinfect them for every patient. And you must disinfect the impression, the crowns and the bridge, all the other processes that have come directly from the laboratory. It's very important to disinfect them as well. All these disposable items, you can easily get it from the Pakistan, and you can get it from Smile Disposable in Lahore, and even they can deliver you at your clinical doorstep. The number of Smile Disposable you can see in the end of this video. If we act upon these measures, then we will not be the vector in transmitting these infectious viruses from the infected person to the other innocent people in our clinics. So this was my little effort in the mission of prevention of these viruses on behalf of Dental Art and Pakistan Academy of Advanced Dentistry. Thank you so much.